So this is still derived all from the CHRYSALIS study, which was a collection of, I think, 250 patients with AML, 75% of whom had FLT3 mutations, who were treated with the study drug Gilteritinib, a very good FLT3 inhibitor. And it's analyzing, again, the depth of their response molecularly. And in this particular abstract, we're also looking at mechanisms of resistance, patterns of relapse. Whenever you're using a targeted agent like a kinase inhibitor, the cancer is going to respond with some mechanism of resistance. And this all started with BCR-ABL inhibitors, where you add Gleevec and then you see a resistance mutation emerge. So people have been looking very keenly for these mutations to emerge with FLT3 inhibitors. With one particular FLT3 inhibitor, Quizartinib, you saw emergence of resistance conferring point mutations that Gilteritinib was sort of designed to inhibit. And so we wanted to know, well, what was going to emerge with Gilteritinib treated patients. And what we saw were actually very few FLT3 mutant, new FLT3 mutations. Really what emerged was a handful of a very specific mutation called F691L. And that's what we call a gatekeeper mutation. The drug actually does inhibit it if you use a higher dose. And in fact, what we stated in the abstract is that any patient who was on the very highest dose didn't develop this mutation. So we think we actually have a pretty good idea of what kind of FLT3 mutations might emerge as resistance to this particular drug from that abstract.